Hey, good evening. This is Dr. Karen Sullivan. I am back with you for another Eye Care for Your Brain. This is our live weekly Facebook broadcast where we bring you free evidence-based brain health information to educate and empower our very beloved brain health community. And tonight we're returning to a really special topic close to my heart, which is essential tremor. A few months ago, I offered a 4-hour webinar on our website, Eye Care for Your Brain /webinar ET, in which we had 4 hours of all sorts of really important information focusing on the non-motor symptoms of ET. We talked all about the symptoms that other people can't see, that doctors don't talk nearly enough about, and it really was a wonderful opportunity for me to go really in depth with a topic that I knew a lot about before, but boy, I came out of that experience feeling really empowered. And the two pieces of that webinar that I took were all about the cerebellum and validating for folks, hi you guys give me such a nice warm welcome, validating for folks that ET has both visible and non-visible symptoms, and that's really where the non-motor symptoms come in. Everyone knows it's a tremor disorder, but I really tried to encourage folks to think of it more as a neuropsychological disorder, which means that there are non-tremor related symptoms. And so what I'm going to do tonight is pull out one of those pieces, which is the social side of ET. It is so prominent in people's lives who have ET. And so what I mean by this is, how does it feel for other people to witness your symptoms, to see your tremor, to see you sometimes struggling to pull a word out of your memory, sometimes, all the things we talked about in the webinar, the emotions that can feel really dysregulated and, sometimes a little bit out of your control. So after I'm done doing the lecture tonight, I'm actually going to have Carrie post a discount code to that 4-hour webinar. When we did it a few months ago, I believe we had it up at $97, and just for like the next 2 days, we're gonna put it up there at half price. So if you haven't seen it before, this is your big opportunity to get the link and join us and get that 4 hours worth of information. I think that you'll really like it. So I enjoyed learning about this topic because, like so many things that I see as a clinical neuropsychologist, your ET doesn't happen in a bubble, and it is just one element of who you are. You are in the center. Your ET is one element. Your social roles, you're a mom, a sister, a brother, your hobbies, your career, your ability to be a friend. ET is just but one thing about you, and that's really the way that neuropsychologists think. We take a very person-centered approach, okay? But the truth is that your ET does not happen in a bubble. You interface with ET all the time. Your ET interfaces with other people all the time. So the question I asked myself as I began my journey of learning more and more about ET was, does this disorder create barriers for people in remaining social? So just taking that question off the bat, I wonder what you would tell me. Do you think that your ET gives you fences that exist outside yourself that make it difficult for you to cross those barriers and remain as social as you want to? So I have some questions to ask you, and this is the way that you can start to really wrap your head around my topic tonight and think, is this something that I should really be thinking about? And the reason I ask you to do that is you're typically not going to be asked these questions when you go to see your neurologist. So do you minimize contact with other people because of your ET? Do you dread other people seeing your tremors, your shaking? Are you very self-conscious of your tremors? Do you avoid meeting new people because of the ET? Do you avoid going to large social gatherings because of your ET? And if you said yes to any of those questions, you really aren't alone. It is such a common part of having this disorder that it's really a shame we don't validate it, because I think so many people think there's something wrong with me. What's wrong with me that I just can't go out and do the things that I used to? What's wrong with me when I start to get a little self-conscious that my tremors go through the roof and they get a lot worse? So early in the 2000s, researchers finally validated the psychosocial psychosocial side of ET. So we've gotten pretty darn far with the neurological part, and that's that whole first hour of our webinar. And that's really information about where ET happens in the brain. So not only do we know that it happens in the cerebellum directly, we know two other things. We know even more directly in the cerebellum that it happens in a specialized type of brain cell called a Purkinje cell. And we also know that the cerebellum doesn't exist in isolation either, just like we don't. And it's connected to all sorts of other areas of the brain. And that's where we get a lot of the cognitive symptoms. There's connections from the left cerebellum to the right frontal lobe, the right cerebellum to the left frontal lobe. And that's just to name a few. So ET is much more complicated than just shaking, just a tremor disorder. So when we talk about psychosocial things, what does that really mean? You know, I don't like jargon, so I just want to be like, that sounds a little, out there. What does that mean? That's basically how do we function within a social world, right? How do we feel about ourselves psychologically, and what do we then bring to social exchanges? So the four things that we know are very prevalent in ET are embarrassment, social anxiety, fear of negative judgment, and low self-esteem. So you tell me, of those four, if you're listening to me right now, which of those four really resonates for you? Which four of those do you feel like has kind of gotten you, that we need to spend a little bit more time healing you on? If those symptoms go untreated, there's a lot at stake, okay? They can develop into a mood disorder. We're going to talk about that tonight. They can worsen your cognitive symptoms. We're going to get into that one too. They can further reduce something called your tremor disability. There's your tremor, and there's how much it impedes your independence, your function, and your quality of life. It's not just a movement disorder, right? It's so many more things that get brought to the table. And maybe most importantly, it can reduce your quality of life and make your tremors worse. And you guys all know this. My patients with ET all tell me, the minute I get anxious, forget it. I'm shaking all over the place. Now, these psychosocial symptoms are established in the literature, scientific literature. It's only been there for, 10, 15 years. But the issue that I take is it hasn't made the jump into being commonplace knowledge or intervention within clinical relationships. So what I mean by that is when you go to the neurologist, sometimes even when you go to a neuropsychologist, they just don't know enough about ET, and we still have room to grow, especially in where I am, American society, in getting rid of this old hierarchy between doctor as the all-knowing expert in the room and patient, right? It's really important that we start to level that out and encourage and respect the expertise that patients and their families bring into the exam room, right? My philosophy, I just said this today to a patient, is you're the biggest expert in you and your symptoms. I bring to the table some clinical expertise, some academic expertise, some research expertise. And when we share information and put our heads together, that's how we're going to get you better, right? The person in front of me knows a million times more about ET than I will ever know as someone who doesn't have that condition. So people with ET report a whole lot of embarrassment. So when we look at the research, what it tells us is that between 19 and 75% of you with ET would write down that you feel a sense of embarrassment at times because of your symptom. And if you have a head tremor, in this one study done by Dr. Lewis, who's really quite the expert in ET, probably the world expert, he's down in Texas now. In 2009, he did a study that showed 100% of folks that they asked with a head tremor said that they experience embarrassment. So right there, we have a new informed intervention, right? If folks have a head tremor, we need to be asking them about embarrassment. And the reason it matters is if we don't talk about it and we don't support people through it, embarrassment becomes social anxiety, becomes social phobia rather quickly. The research tells us women report more embarrassment in ET than men, and it is associated with an 86% increase in the amount of tremor medication that people take, independent of how bad the tremor actually is objectively. So think about that. It makes you want to unpack anxiety and really think, what is that complex feeling when I get that kind of warm feeling like, oh God, people are looking at me? It's really a combination of shame, it's a combination of self-consciousness, and it's a combination of anxiety. A stronger predictor for caregiver stress in their care partner who had ET was embarrassment. This is stronger than physical impairment, stronger than cognitive impairment. So what that means is caregivers are sensitive to their loved ones feeling a sense of embarrassment publicly. turns out embarrassment is the second most strongest predictor for people who get DBS, deep brain stimulation. And it's very strongly linked to depression in ET, okay? So I said before, what is embarrassment? Let's really break that down. It's a shame-based emotion that has its own thoughts, its own specific emotions, its own specific behaviors, and it's often related to our own judgment of how we perceive other people see us, and that we will be judged as doing something unacceptable. And I think in ET, so much of that is related to two things, is what I hear from my folks, my patients, is people are going to think I'm drunk, or people are going to think I'm a nervous wreck and there's something wrong with me. Okay, so that's a great in for cognitive behavioral therapy, because we haven't confirmed that with anyone else necessarily, right? That's our fear, that's our projection, right? So this is part of what neuropsychologists do, is we take our intel that we know about disorders and we try to inform recommendations and interventions. So remember I said before, embarrassment in and of itself stinks. Who the heck wants to feel that way? It's one of the worst emotions. But over time, it can get worse and develop into a social phobia, right? All of the world is on a spectrum, and mental health is no different. So at times you can feel just a smidge embarrassed. Other times you can just feel so bad you go into a panic attack. Social phobia, though, is when it becomes really intense and it's persistent and it keeps you from doing the things that you want to do. Symptoms can include really, really strong anxiety in situations where you feel you might be judged, embarrassed, or humiliated. And up to 50% of folks with ET meet criteria for social phobia. And that's really why I made it one of the hours in our 4-hour webinar, is I wanted to just really sink my teeth into this topic and help people understand what it is so they don't feel weird, they feel normal. This is part of having ET. And what can we do about it, okay? So once folks with ET have social phobia, what we typically see is there's a lot of anxiety and avoidance around public eating, okay? Being seen taking a drink, being seen using a fork or a spoon. And a lot of times that is part of the psychological pain, because think of how human eating is. I mean, eating is social, breaking bread, right? We do this to bond with people. We do this to connect with people. So that's pretty significant. The other big fear with social phobia in ET is public speaking. And I've spoken with quite a few people that that's their issue. They have to do public presentations for work and they feel really, really scared. So there are definitely strategies that you can use, clicking a PowerPoint button as opposed to going and writing up on the board. And I know people are so good and creative where they come up with these things by themselves, but that's why I love the idea of communities talking, because what worked for you might work for someone else. There's no reason to reinvent the wheel because a lot of people are going through this. So what I really want you to understand is that being socially anxious, socially withdrawing, I really think for a lot of people it's a part of ET. In what we call the DSM, which is kind of like the psychology Bible, one of the ways that they've kind of done us dirty with neurological disorders is having a brain health issue is often an exclusionary criteria. So what I mean by that is when they start looking at, well, what's social phobia? One of the things you can't have is a neurological condition that would account for that symptom. And so if you've been listening to me now over these 3 years I've been here, I hope one of the things you've picked up on is oftentimes what gets manifest in the body is parallel to something that gets manifest either cognitively or emotionally. So if you just think about tremor, right? Tremor in its essence is difficulty starting and stopping, right? We talk about this a lot in the webinar. This is part of what the cerebellum does. It's the brake system of the entire brain, right? This is where the emotional, no filter, putting your foot in your mouth thing can kind of happen from. And so part of that is trouble stopping, right? Sometimes there's troubles with initiation, with motivation in ET, and so we can have trouble starting. So oftentimes if looks like there's an explanation neurologically, well, it's almost like, well, I'm not going to diagnose social phobia because look, they're shaking all over the place. Probably that, directly is the only thing I'm seeing. So I really think this is the reason we're so late in bringing psychosocial symptoms into the ET conversation and validating them. So there's a huge obstacle when you have ET and social phobia. This is probably something that feels comforting in the moment, but I want to convince you that you're doing yourself no favors and you're actually making your problem of social anxiety worse if you do this. And this is called avoiding. Avoidance. This is one of the number one things psychologists talk to their patients about. And I want you to take some time right now to be honest with yourself about your level of avoidance and its impact on your life. How is ET making your world smaller? So how often do you avoid social events? Has it gotten to the point where you might have a social phobia here, right? When is the last time you went to a big event like a wedding or a graduation or, a dinner party of 8 to 10? Is avoidance keeping you from living your full life? What are you missing out on by being avoidant? Okay, so what do I mean by avoidance? It's staying away from certain people, certain places, not going to places like restaurants, eating by yourself. If you are out in public, kind of trying to make yourself a little bit small, kind of hiding, right? Not talking, trying to, get the food in really quick so people don't see you. The problem is, anxiety will bite you in the behind. It absolutely will every time. You may feel good in that moment, but what happens, a week later, 2 months later, 6 years later, is it actually creates more anxiety. And so how does it do that? It makes it harder for you to do the next time. You have reinforced yourself that if you leave, if you don't go, you don't experience the anxiety. And so it makes it harder for you to do the next time, okay? It reinforces stigma. It reinforces this idea that there's something wrong and that you shouldn't be seen lifting up a fork or lifting your cup to your mouth. It can make you feel ashamed. It can be, it's like, even if it's unconscious, like I can't be in public, I don't want to be seen by other people. It never allows you to face your fears and prove yourself wrong, that it wouldn't be the end of the world, that people will be kind, and that you can find a way to live alongside the ET and not have it be the dominant person behind the wheel. And really what I'm excited to talk to you about tonight, that we get into a lot in the webinar, is it keeps you from living your values. Oh my gosh. So I want to talk about that. And it robs you of all the benefits of being socially connected. That has been the biggest advance in brain health and neuroscience, I would say, of the decade, is the contribution that social health makes to physical health and to brain health and mental health. We are social creatures. We are literally designed, especially brain-wise, to be interpersonal, to be interdependent. And when we are not, that is not stimulating to the brain. And what we know so well nowadays about the brain is it's use it or lose it. You need to be actively engaged. And we have many, many structures in our brain that are just there to perceive social interactions. The fusiform gyrus is just there for facial perception. That's all it does. And if we don't stimulate it with different and familiar faces, those cells might not think they have a job to do, okay? And really a huge thing here is that we have an opportunity to reduce the impact of your tremor if we validate and treat these psychosocial symptoms, okay? So the way I want you to wrap your head around this is that these symptoms, your physical symptoms of ET, are not quiet. They're not silent. If you actually listen, they speak and behave. You might think I'm going off the deep end here, but this is where cognitive behavioral therapy comes in. There is a microsecond pause between our perception of something and our emotions, the way we react, our judgments, the way we label things, and our behavior, the way we react. These brief pauses, these tiny, less than that, are opportunities for us to change our thinking, to change our beliefs and our worldview. I wonder what your ET says to you, if you can really tune in and listen. So some people have told me everyone's staring at you. They all think you've been drinking. Kind of like I said before, kind of a stiff posture, kind of looking down, making yourself kind of small, right? So I want you to just start to pay attention to when you're out socially, what is kind of happening very quickly within your own brain right before you potentially start to feel embarrassed or anxious, okay? So as you know, what I care about is, well, what are you gonna do about it? So I love to educate and enlighten, but I always want the practical steps. That's really why I love being a neuropsychologist. So I told you before, what we care about here is living your best life. And the best way that I know how to do this is to identify your values and align your values with your social life, okay? So we've got many, many values, and I'm gonna name a few, and I want you to listen to me, and I want you to pick your top 3, okay? Service to others, that's probably my number 1 top value. Dependability, loyalty, love, family, creativity, humor, compassion, adventure, motivation, optimism, respecting others, good health, courage, and education or information. So values are deeply held beliefs or standards that we hold dear to our heart that are kind of like our reason for living, right? So think about it. Like, what is your deal? Like, what are you really committed to, right? If it's family, start to think about, is ET really getting in the way of you being present, of physically showing up for people? Do you maybe avoid certain things for, special family members and you feel terrible about it, but just kind of can't handle the birthday dinner, whatever it is? That's a problem, okay? So think about who guides how your values get lived. Is it you? Or is it your ET? So there's a few ways that you can get back in the driver's seat or maintain the position in the driver's seat. And these are the 3 tips I'm going to give you on that. So the first one is what you're hopefully going to do soon, which is identify your values, right? And every morning when you wake up, you're going to do a positive affirmation to get this value so beaten into your head that when you are faced with awkward, anxious situations, you go back to your values and say, how can I live my value right now? This is my virtue. This is what gives my life meaning, and I'm not going to let ET take that away from me, okay? So reminding yourself, too, that when you live by your values, you are living a life worth living. You are living a life that is the best for your family, and I truly believe it's the best life for the world. We need more people living their values, right? And having integrity and being actively involved in the decisions that they make every day for the good of themselves and the good of the world. So the other thing you can do is get really clear, like I was saying before, on those beliefs, right? Your beliefs, if you imagine yourself going to a cafe and eating a bowl of soup, right? Be honest with yourself. What do you think is going to happen? What will other people think about you when you sit down? What will other people do? Okay? And that's where you have an opportunity within cognitive behavioral therapy to change your viewpoint, to change your lens. You can ask yourself a couple questions like, how realistic is this that people are going to stop everything they're doing and stare at me? How realistic is it that people are going to think that there's something wrong with me? You may have had some jackass in your life that has said something stupid to you like that. Okay, so they're annoying, and you get to go on being your awesome self, right? So as you start to think like this, you're really going to want to become a detective, right? What does a detective do? They analyze, they assess, they evaluate to see if their impressions are accurate. So you're really going to start to think about, what? Okay, I'm at, my best friend's son's wedding, okay? And they're just getting ready to serve the food, and I have a big wave of anxiety, okay? So some beliefs behind that urge to get up and go might be people are staring at me. People are thinking something's wrong with me. They're going to think I'm crazy. I'm going to spill coffee all over myself. I'm going to look terrible. Some people are more non-verbal. Some people get images. They imagine themselves falling. They imagine themselves spilling food on themselves. They imagine how embarrassing it would be to not be able to come up with the right word or to remember someone's name. Once you recognize you are having an image or a thought that is not helpful to you, you have to challenge it. Challenge it with love. Am I seeing this clearly? Am I making assumptions about other people? What evidence do I have that this is true? Is this a helpful or an unhelpful thought? And this is my favorite one. How would I think about this if my best friend told me this was happening? How would I advise my child if they came to me and said, you know what, I think I'm going to leave because, I'm just feeling really overwhelmed? The goal is objective, balanced, and helpful thoughts. So consider all the evidence, right? You're trying to be objective here, not subjective. And think about alternate viewpoints. How would you tell someone you love to respond in that same situation? Challenge those thoughts. Try to get back to objective, balanced, and helpful, okay? And then after you replace the kind of negative thought, image, belief, reassess your anxiety and say, you know what? How is it that I feel right now? I guarantee you will feel better if you can come up with an objective, balanced, and helpful thought. Yeah, people might look at me, but I have my script. I know if they come over and ask me if they can help me, I'm able to say, hey, I have a neurological condition called essential tremor. It's actually like the least interesting thing about me, but you probably noticed it first, right? When we minimize things and don't make things a big deal, other people tend to follow. And the whole reason we talk about this, you all, is because we need you out here in the world. Do you know how much we are missing out on by folks who have social anxiety not being involved with us at get-togethers, at office gatherings, at parties? We want you to be a part of the world because you're awesome. And we don't want you to miss out on all the health benefits of being social, all the brain benefits of being connected with people, and all of the mental health benefits of eating with other people and remaining interdependently connected. It's really, really important. So the final step is behavior change. Once you start to actually act on your new thoughts, start to have them more automatically, where you don't have to kind of force yourself to try to think through the belief that's leading to the anxiety. You start doing more, you start more comfortably engaging with folks, you're less self-conscious, you are more you. Doesn't that sound like a wonderful goal? I love that idea. So what I want you to do is never stop learning. This is just but one aspect of a very complex neuropsychological brain disorder. And we want you to learn everything that you can about it. So if you liked the approach that we took tonight, I try to be very comprehensive, talk in ways that is easily understandable, but still pretty darn scientific and getting really important evidence-based, research-based information across. Please take me up on this offer for half-price ET webinar. I think I'm only going to leave it up for like a day or two. So if you're seeing this live on Wednesday night, you might just want to get it. We then send you a link to watch all 4 hours of the webinar. We have the PowerPoint presentation. You also get that too, so you can actually have like the information written down, so you're not just trying to write as much as you can. And as always, it was truly my pleasure to be with you tonight. I've had a really long day, and this was something I was really looking forward to all day. And also, it's my mom's birthday today, so I am gonna go meet her right now. She's in my kitchen, and I baked for her a Spanish orange olive oil cake. How good does that sound? Olive oil cakes are just out of control delicious if you all haven't had one. But now let's add in some orange. I mean, I am too excited. Maybe I'll even post you all a picture here of my cake because I don't bake too often, so I was pretty proud of myself. I hope you all have a wonderful night. Thank you so much for spending this time with me, and please take good care of yourselves. Bye-bye.